I'm first telling
Hi.
that. Okay, okay. That Ronnie has a some problem, noisy breathing, and he is diagnosed case of laryngomalacia. Now I have to talk with Ronnie's mother, Suhana. Okay, I'm starting.
Okay.
Hello, good
Okay.
morning.
Good morning.
I'm Dr. Emma, one of the children doctor in this hospital. I believe I'm talking with Suhana, Ronnie's ma'am.
Yes, doctor. Nice to meet you.
Yeah, thank you. Nice to meet you, and thank you very much for coming here today, Suhana. So today I'm here to talk about Ronnie's health conditions. Is that a perfect time for you?
Yes.
So before I start, do you want anyone to join this meeting or shall I start?
Yeah, you can start, doctor.
Okay, so can you please tell me what is your concern or health update about Ronnie?
Rooney has a problem with noisy breathing, and one of the doctor told this a problem because of the larynx. I'm not quite sure what's wrong with that, and they are telling me that you're gonna come and explain the condition to me.
Yeah, I'm here today to answer all your questions. So yes, after examining Ronnie, we find a condition that is called laryngomalacia, or we can tell that soft larynx. So have you any idea about laryngomalacia?
No, what is that, doctor?
Yeah, okay, I'm explaining it very easy way. Can you please follow this drawing?
Yeah.
So larynx, what is an organ in your body in front of our neck? I am showing by this my finger, and this larynx we can call voice box. What happened? This voice box we are using when you talk, and the children who can't talk they use this when they cry. Later they use for talking. So I'm drawing two pictures. I'm comparing between the normal larynx and the laryngomalacia larynx. This is normal larynx. What happened in laryngomalacia larynx? Look, Ronnie's larynx that is floppy, and in front of the tissue there's some cord, and all are soft. So what happened? When Ronnie he cry, he take the breath inside. Um, this go with this soft larynx. So for that results, there is a sound produced that is called laryngomalacia. Am I clear so far?
It looked quite terrible. So, how can my child take a breath if this is so soft and floppy?
Yeah, I understand. Can see how much keen mother you are, but I have to tell you that it's completely a benign conditions, and for that reason, it doesn't need any treatment. What happened? It will go away when Roni will be in 1 year of age. It reduce 70%. When Roni 2 years of age, it will go 90%. Are you following me?
Yes. Is there any reason why that happened?
The reason I told you that the voice box larynx is floppy, I draw the picture and show you. For that reason, actually, this problem occur.
Is that related to the family or genetic problem or because of medication I have taken during the childbirth?
Ma'am, I understand that you really worry about and how much you think about Ronnie's health, but I'm to tell you no, nothing is related that. I'm reassuring you completely that it will be go its own like 1 year and if not then 2 years. So uh, no need to think anything about that. Okay, and no
Okay, that's great.
anyone fault about this matter.
Yes, doctor, 2 weeks ago we came to the same hospital because Rooney has a problem with acid. They called us a reflex. They didn't treat any treatments, and I want to know why they didn't give the treatments for that.
Yeah, I understand that. The people who have laryngomalacia, sometimes they have this problem, GERD, that we call gastroesophageal reflux disease, the conditions. So it's throwing up. So when Ronnie came 2 weeks back, it was just some throwing up, no other problem. After examination, we find for that reason we told that no treatment needed. But I can tell you one information. You can give him thickened formula. You can prompt him after feeding for his better digestions, and also if it's worsen the conditions, I'm giving some medication who will what will be affect his stomach, not worsen these conditions. Okay, how does that sound?
All right, doctor. Thank you. It sounds great. But I mean, they haven't done any tests like CT scans or any tests, and I'm so sure this is the main cause of my child problem.
Yeah, I understand how much worry about your child, but I'm to tell you that this Laryngomalacia guard, everything is a clinical diagnosis. We do actually no need of test, but I want to arrange a meeting with the ear, nose, and throat doctor, and he will decide that any test needed or not, and confirm about that. Okay.
Okay. All right, thank you, doctor.
So, have you any other concern regarding Ronnie?
So I'm one other thing I'm worried is that why waiting for the 1 years of age? If some, how could I know if the condition has been worsened or when shall I come back and see to you?
So it's an excellent question, and I want to tell you that when you seek any medical advice, some features we notice that we called warning sign or red flags. If you notice anything, you seek medical advice. Like during noisy breathing, change the color of Ronnie. If her breathing sound change, her chest skin are going pulling in and pulling outside of the ribs, then you can seek immediate medical advice. Okay.
All right, thank you, doctor.
So may I summarize what we discussed today for a better outcome?
Yes.
So today, Suhana, you come about Ronnie's health conditions, and we find that he has laryngomalacia. I draw a picture and told you about what is laryngomalacia, why it's developed for the floppy voice box, and also I told you about the treatment that it will go away when he will be 1 year or 2 year of age, and also I talk about GERD, and also especially I given some warning sign. If you notice that, you can seek medical advice. Okay.
Mhm. Okay, thank you, doctor.
Okay, so Suhana, I'm giving you some trusted website leaflets, and I'm adding a support group where you find laryngomalacia patient and people, and that will be much more beneficial for you. Okay,
Okay.
and thank you very much for your time and the soon recovery of Ronnie. We are wishing. Okay,
Mhm.
so I think end.
Yes, very good.